My very special guest is Marco Cuniberti, who is a physical therapist at Aspire Academy in Doha, Qatar. Aspire Academy is one of the leading, if not top, youth development academies in Asia, if not throughout the world, dedicated to developing elite talent at the world level. Marco works with a variety of athletes in different sports, as he'll talk about. He is a physical therapist, as I mentioned, who has a master's degree in sports physical therapy from the University of Siena in Italy, where he is originally from. Thank you for being with me today, Marco. It's a pleasure to speak with you.
Thank you.
Maybe you can talk about some of your current role, what you do at the moment, and a little bit about your work history or background.
Yeah, sure. And so in 2017, I moved here in Doha, because the head coach of fencing program here in Doha is Italian coach, and he asked me some physiotherapy that had a solid background in fencing and sports culture, we can say. And then because I was working previously in fencing federation in Italy, so we have a direct link, and then he asked me to join here in Doha. At the moment, I take care of athletes for 2 and 3 different sports environments. So I take care of fencing program, squash program, and development athletics. It means the first 2-3 years of academy before they starting to move in the performance groups.
Okay. Yeah. Go ahead. Sorry.
Yeah, no problem. And yes, I can say that I have 10 years of experience in physical therapy in general. And after my master degrees that I finished in 2016, we can say that I move more forward to the sports environment. And I have to say that the possibility and facilities in Qatar is great.
Yeah.
We have huge possibility to help development players and athletes and men, we can say, at the same time.
Maybe you can talk, Marco, a bit more about some of the resources that the athletes have available to them at the Aspire Academy.
The great things for sure for the athletes is the huge amount of great professionalities and people they have around. So not only for medical side, that they have the possibility to have a contact with daily with physiotherapists, with different backgrounds, with doctors and nurse, but also they have the possibility to have coaches with great experience, SNC, biomechanics, psychologists, data analysis, match analysis. Depending on the sports and the needing of the sports. They have the great possibility to have different practitioners with different background and different nationalities. Right. So we can say for development and the of the play is a great possibility, opportunity, and also the big facilities they have. Talking about for football, amazing pitches. For squash and other sports, great facilities inside, and mostly with the ability to use it all the days and all the day.
Right. So it sounds like they have not only a combination of access to professionals with a lot of experience, but also the physical sort of environment or the training facilities also sound top notch.
Yes, and at the same time, because it's academy, they have the school and the sports on the same time, on the same place.
Okay, so their school is integrated into the academy then.
Exactly.
Right. Okay. And so are these youth that you're working with, are they coming from all over the world?
Normally they have to be from a certain amount. Normally it's to be 80% has to be from Qatari. Okay. Or people they were born in Qatar.
Right. And so these are athletes that I'm guessing are identified as talented athletes before they come to the academy?
Yeah, they're supposed to be talented. There is a talent and process of talent identification at the beginning, and during the years of academy, they also can enroll other students, and it could be also part-time. So maybe they can also have the school time in another school and enjoy part-time. So maybe only in the afternoon. So it
Right.
depends on the needing of the sports. And yes, it is. I mean, we have to also to say that there is not a huge amount of people here in Qatar talking about citizen in Qatar. So it's a bit more difficult to find a huge amount of people.
Right.
But based on the amount that we have, is they have the perfect scenario, a perfect environment to develop the skills and the natural talent that they have.
Right. And in the case of injury, are the different practitioners that you mentioned, like the
Yes.
biomechanists or psychologists, do all of those individuals work with the injured athlete if the athlete needs it? Or
Absolutely. We have to say that for our department is part of hospital department that is dedicated to aspires boys. We can say that normally we divided the injuries in less than 20 days and more than 20 days, like time loss, proper time loss injury, and we can say major and minor injury. So
right.
normally in the major injury, we normally is the physio, this take care of this, is organizing a meeting with all of the practitioners that could be helping the athlete. So normally the coach, the SNC, the physio, the nutritionist, the psychologist, and all the other member of the staff they want to participate.
Right.
We present which is the injury plan. We give some information about the injury and which is going to be the plan from now on, and we try to have some information about all of the stuff, because maybe there will be very soon a tournament and then they would like to have the boy involved, or for example with the SNC we can modify and structure together a plan to make the boy as soon as possible integrated again with the team, partially and then fully.
Mm-hmm.
Or maybe some psychologists and nutrition, they give some strategy based on the kind of the player, the type of the player, the morphotype of the player, or the time that we're gonna miss, we can say, full training, and to give also some perspective. But this normally is inside, but for the major injury, is also really important the role of the family here in Arab country. So later probably we're gonna discuss a little bit more deeper, but it will not participate directly to this meeting, but normally before this meeting, we talk with the family and with the boy at the same time, and we explain what we gonna do, and based on this, we give some support, because without the family, it's difficult to not have a full support and full compliance on the part of the boys.
Okay, so maybe you can talk a little bit more about the importance of having the family on board or involved in terms of the athlete's recovery.
Absolutely. This is why I say that normally we try to involve as much as possible, even with the small injury, even if they have to be in do some imaging, and mostly because most of our athletes are minors, so less than 18 years old, so they have to be involved. But what I understood in this year, and all other colleagues, they can confirm me, is the very importance of the family as advisor in general of the boys.
Right.
And also mostly the figure of the father is quite relevant and important. So the boys are trusting the family, sometimes more than usual and more than what is gonna be right. But taking out the family, it will be already 50% of success in our return to sport and return to play for the athlete and recover from injury. From the basic thing that they are the father normally and the family are how can I say, they help the boy in and they are the family, so the boy
Right.
is trusting them, and even if when they say something, the boy trusts him for sure, the
Right.
father and the family. And also because we can use also the family as a, they transform the injury in a proactive, to be proactive, because maybe sometimes the father also could be an ex-athlete, so he can help him to understand what is going on in this past experience. And for sure the boy, following the family advice with other advice, it will be a great pathway, you can
Right.
say.
So it sounds like the role of the family in Qatari culture is quite important, in particular the father.
Yep.
And for the athletes, they tend to rely on or listen to um, the interests, or maybe the ideas of the family and the parents in particular.
Yes.
And it sounds also like that's kind of getting the parents maybe on board is important for the progress of the rehabilitation.
Yep.
Okay. You mentioned Aspetar, and I just wanted to clarify that, is that the medical facility that's associated with Aspire Academy?
Exactly, because we have to say the Aspire zone is the area in which we work, and we can say the company, and yes, some different department, we can say.
Mm-hmm.
Aspetar is the orthopedic and sports facilities, so it's the proper hospital in which is a reference point not only for Qatar, not only for Asia, but probably for the world, talking about orthopedic and sports injuries.
Right.
There are the Aspire Academy, this is the academy, and then there is the logistic that is organizing events, so is another department.
Right.
So Aspetar, we can all the healthcare practitioner, they are enrolled by Aspetar, and then they have different, could be teams, could be national teams, could be a federation, and could be also Aspire Academy. So depends on the sports and the team that you are dedicated to.
Right. You talked a few minutes ago about the fact that the practitioners work as part of a team environment, or seem to adopt a team
Yep.
approach in the rehabilitation of the athletes. Maybe you can talk a little bit about the importance of communication between the different treatment providers and or between the athlete and the treatment providers.
Absolutely. What we always say normally, for sure, we can talk about a triangle where the athlete is in the middle. We have the family, we have the coaching staff, and the medical staff.
So the athlete, the family, and the medical staff.
That for sure, at the beginning of injury is going to be the first part, and then has to be a clear communication between these three angle of the triangle.
Yeah.
Absolutely. Because without clear communication, this starting to be this misunderstanding that could be athlete, family lose the trust in the medical staff and the coaching staff because they cannot understand what's going on with the boy. The boy can act avoiding training, avoiding effort because it was not clear, and he say, no, my coach say that, no, but physio say that.
Right.
So clear communication and continue update, and you can build a real trust, and the athlete will develop his ability to understand in what's going on about his injury.
Right.
And we can also talk about talking too much or talking too less about the injury. Depends on the type of injury to the athletes, because sometimes you have to choose your words and understand in which kind of athlete you are talking about. We are talking, because sometimes you don't need to share too much information, because then he's starting to centralize the pain, we can say, or starting to over project is their injury, or in other cases, because you rely completely on the boy and is quite mature, you can fully explain. And some of the athletes, they really like to understand properly what's going on biologically with this with their injury, and
Yeah.
also understand the emotion and all the things, and to be on top of this. They would like, mostly with the target athletes, they starting to be more uh, they can understand maybe more better what's going on around them.
Yeah.
um, yeah, we can
Yeah.
say that communication is a vital factor, sure.
I want to touch on a few of the points you mentioned. One of them is this idea of how much information or education you give the athlete. And it sounds like you vary that depending upon the individual that you're working with. And
I can say that education for sure is the first and the most important part.
mhm,
And this part is not gonna, I will not choose my athlete. So I will explain everything, and they starting to build slowly, but starting to build resilience in the athlete and building understanding the athletes. Because if they want to be in a future professional athletes, they will go out from the bubble. They will start to afford the real life, the training, and then probably also to start to think to be alone in their own career.
right,
More than now, they are completely under control of the family, super, all the coaching staff take care of him and them. We can say almost 24 hours of 24 hours. So this education is the first part for sure, to starting to educate them, giving
why is the education important, or how is it valuable for the injured athlete?
as I told you, not because luckily we are not talking always about a major injury. Maybe sometimes there are time loss of 2, 3, 4, 5 days, but they have to start to understand what's going on in this small process, and to starting to project them in a possible big injury.
Right,
Hopefully they will not have another injury, but this same kind of thinking could be applied for training session, could be applied for homework, could be applied for a lot of other things. So education for me is to explain what's going on with them, for them in the injury, using basic word. Don't choose not harmful word. Explain not, and be true. These are
right.
not. We have to be. We have not to mystify the reality. We have to say
Mhm.
what's going on, and also I think the education in this case is another small step in the to the maturation of the player.
Right.
Because if you're talking with the player at the same level, it will be more appreciated, because you are not in the 2, 3 level up, and then you say what he has to do.
Yeah.
Uh, this could be for a small injury to big injury, can be also for same in the session. If you're not involving in the decision making the player and the athlete, even if it's 12 years old, to 12 to 18 to be a mature athlete, uh, this is the moment when this is why I always say the most important role of our teams, for mostly, for example, for physiotherapy side, for the physical therapy side, is with the youngest, because with the 18 years old, they've already all the background already quite solid, so you can just modify something. With them, you can start it to building.
Right. So with the younger athletes, you're still in a position to modify their habits, how they train, and it sounds like giving them education and information that's honest, clear, and straightforward is really important in helping them understand what's happened And also you mentioned that's really valuable and maybe helping them prevent future injuries so they know kind of what's happened to their body. Yeah, and I think those are great points. I wanted to pick up on that issue of trust
Yeah.
also that you mentioned. What is it that builds trust in for the athlete in their physical therapist or treatment provider?
They could start with the basic things that is out of my job. That could be in time. If I say something to them, it's gonna be this, not modify all the time what you say before, not and change. Starting with these small things in the routine, you build trust in the athlete. And could be in the session. As I told you, I always like that guys are be involved in the decision making.
Right.
Some of the session maybe I will decide all the session, all the exercise, all the treatment that we do. In other times, I'm starting to ask them what they can do. If they can push a little bit more, perfect. If they have to do one step back, I will appreciate it them. This is quite difficult because we know that everybody of us he was a kid. Sometimes you can fake something, you can overreact about something, and then you started always to give a step back. So this is the role of education in this part, and then at the same time of the trust of the athlete, because sometimes you cannot always to be strict and you cannot be too much soft. You have to manage between the two, and athletes, they will follow you.
Right. You talked about athletes on a couple of occasions. You mentioned the importance of athletes being involved in the decision making or having input. And maybe you can elaborate more on that point and why
Absolutely.
that's important.
It's easy to say in English this word, but there are a lot of meaning behind. But empower the athletes is one of the most important things. That obviously we have to shape the treatment to the athletes. So we are talking about 12, 13, 14 years old. I cannot treat them like a professional player of 30 years old with different background. So for sure, playing with metaphor, playing with some games during the session, during the rehab, it will be helpful for the player to understand. And as I told before, if you give some part of in the decision making, they started to be independent. If you started independent, it's gonna be the goal that you want to be when they finish the academy, and they're gonna start to approach the real life. You can say the real sports life.
Yeah. So it's important that they have that independence, particularly if they progress outside of the academy where maybe there aren't as many kind of monitors over what they're doing, or, they
Yeah,
have
because
to look after
for
themselves.
example, even in some kind of injury, for example, the overuse injury, that could be, an example, a tendinopathy, when the role of the physio is important at the beginning to plan some of the exercise and the treatment. But most of the job has to be by the players to maintaining, because it's not a injury that is solving in 1 week, 2 weeks. The tendon needs a time to adapt, and needs time to adapt. You have to think about 6 months, 12 months. So this not be is going to be out of the training session, but they have to keep their own routine. And same could be for some flexibility exercise or other things. If you start with the young to put these tips inside the mind, they have to be a little bit more independent. For example, what I do sometimes in the session, I give them the trust. For example, I have to finish to assess one other player. I say, okay, we start with these 2-3 exercise, and I will come back to you. So I give them the responsibility to start with this. At the same time, I will controlling a little bit from the corner of the eye.
Right.
But it's the time to start to see if what they want to be.
Right,
They
right.
want to do one step more.
Yeah, so you kind of give them, you say, okay, here's a few exercises. I'm going to go and come back, and and then if you have the sense that they're, it gives you the chance to see whether they're operating independently and
Exactly.
following through, or maybe getting sidetracked a little bit. I thought it was really interesting, Marco, that you mentioned the term empowerment, and you said that it could mean different things. Maybe you can elaborate on what that means for you specifically as a physical therapist.
Absolutely. Probably where I already touched this point a lot of time, but you can also help me to elaborate more this part. Sure. The boy, in this case, the athlete, has to be his own maker of his, we can say, destiny. He has to
Right.
know what he has to do, and he has to know that he has to start to think about his career in general. Not for sure with the 12 years old boy, but we have to sometimes to put some tips, some small brick in the wall,
Right.
and elaborate, because talent is not the only thing that is part of the athlete, but
Sure.
hard work, resilience, start to be independent is the second big part that then can compose an athlete.
Mhm.
And with the talent, maybe you can survive 1, 2, 3 years at high level, but with the methodology of training, daily activities, that could be sleep, nutrition, and all the other aspects, you can give them the possibility to create a solid career.
Mhm.
It could be high level, or at least you can create a professional career for
Would you
the players.
would you say then that it's important for the athlete to assume responsibility for their rehabilitation, or not just their rehabilitation, but it also seems like their training in general? Is that what you're suggesting?
Absolutely. There is not much difference from the homework in the academy, or the assignments, or the exams.
Mhm.
It's
So,
only translating the sports culture in the sports life, but is the same.
right, right. Maybe you can talk a little bit about some of the specific challenges that athletes experience with their injury recovery.
Challenges. Sure, we can talk about something about the emotion that they have in general. We can talking about something about this, or
Yeah, sure. It could be related to their emotions, or it could be, anything that you experience or that you observe that is difficult for the injured athlete about their injury or their recovery.
yeah, we can say that always depending on the kind of injury the athletes they coming from. When you have a ACL injury or major injury that take a long period out of the training session, and we can say also in some part also a lot of time out of the we can say normal activities or sports activities, not the proper sports they will build in the career, but just normal activities. Running is difficult to manage at the beginning. I mean, it's quite easy to find fear and anxiety in boys, because maybe it's the first major injury they have in their life, because in 3 months they're gonna have one of the tournament they like it, because for example in Aspire sometimes boys are traveling all over the Europe to do some tournament, so they are expecting this moment. They normally know, more or less knows when they happen. So if
Yeah.
something happen just right before, they are always already projecting to, I will be part of this tournament or not part of this tournament.
Mhm.
So the difficult challenges for me is to bring the athlete to the reality. Explain, as we say at the beginning, clearly and with clear intention, with if we're gonna participate soon or not soon to the normal training, and we're gonna do our best effort, and he has to do his best effort to try to achieve that.
Right.
And not, and for me, it's important. It's not a question to delay the treatment, but and so the goals, but put some intermediate goals and see if you are able to achieve these goals, if you are able to learn in this part. Hopefully, you're gonna move in the other phase of the treatment, the phase of the recovery, and so keep the boys challenged and focused on what's gonna be the pathway for the injury.
Right. So it's important that the athlete can meet certain criteria in the goals or the progression that you set out before they return, even if, you know, they really want to compete. Like you mentioned, they're in their mind, the athlete is, okay, there's this competition, I want to compete in it. But it sounds like an important part of your job is outlining the steps they need to take before they can compete, and if they can meet those, great. If not, then, you know, maybe there's some readjustment, or maybe they're not competing.
Absolutely. And other things depends also in the kind of injury, because we have to remind that talking about 12 to 18 years boy is a particular age in which there are one big injury in this moment, it will be affecting the boy in the future. Mm-hmm. So depends also in this, talking about sometimes you have to enlarge a little bit the time of the recovery, and sometimes it has to be difficult to explain the boy. Maybe, for example, in a stress reaction injury, in which something is going on, but is affecting a little bit the player. So it's difficult to explain them. They have to stay maybe 10 weeks out of sports, even if they are able to run, because it's difficult to make them understand which is gonna be the negative long-term outcomes. So this is another big challenge. So difficult to make them understand that maybe it's better to lose some weeks now and some tournament now, even if they want to really to participate, instead of create big issues after.
Right. So especially for the younger athlete, it sounds like they're thinking maybe more short term, that they really Absolutely. Have a strong desire to
and compete. Not only the young athletes.
Yeah, right. But yeah, whether it's a younger athlete or maybe even more experienced, it sounds like part of your education or information is outlining the potentially negative consequence of competing too soon, and how that might impact their play or their performance down the road, or that it might mean more time missed later on. When you give that information to athletes, are they receptive to it? Do they listen, or are they still, no, I'm going to kind of push through and get back? How do they handle that information?
I can say 50% and 50% yes, 50% no, because it's normal. I was an athlete, not professional for sure, and I put in their shoes. So if I'm able to running, I'm able to everything with some pain, I have to stay a long time. You cannot project your injury because you say I'm good, I'm good able to train. Yes, I'm. And also it's difficult to make them understand that maybe they already think about this injury because maybe they complain about some pain, and maybe they already think about, okay, maybe 1 week or 2 week rest with some modifying and I will be there. So it's difficult to transform this own thinking about a small injury to become a long term. But I have to say that depending on the athletes, you can, if you are clear from the beginning, if you are explaining which is gonna be the negative outcomes, and is coming back to the what we say before, involve the family in this case is important, because if the family really understand what's going on there, they could act with their own strategies to make the boy understand better
Yeah.
what's going on
Yeah.
on there.
So it sounds like, you have to do a lot of education and explaining, about healing or kind of, again, what could happen if someone returns too quickly, not only to the athlete, but to the family who seems like
Exactly,
has a
and
big impact on them.
put the right meaning in the things, because luckily we are developing player. So it's not talking about players, they have a contract ending in 2 months and they have to renew, and then if they have injury, or so it's going to be complete another kind of um, management of the injury.
Mhm.
In this case, the players, the boys have the possibility to recover, and they have no have to be stressed, and either we have to say we are very very helping by the coaches, in which they are supporting us in with this kind of thinking, that they don't need the boys they participate to winning, they have to develop players.
Right.
And same for us, if we need, you have to need to be sure that there is going to be a kind of injury that has to be solved in the right time. Maybe we say sometimes a little bit longer, because we have to uh, I think also this we can say is empowering the athlete. Is
Mhm.
also another shade of uh, make him part of the
The
decision
process.
making in general, the process. Yes.
Yeah. And it sounds, because you're working in a youth academy, you mentioned that, these athletes are still in a developmental phase of their athletic career. So there aren't necessarily the same pressures to get back as you might find in a professional environment where there's contractual issues or, maybe other kind of pressures that a
Yep.
professional athlete has. Um, I thought it was interesting, and I want to just touch on that point about trust, because earlier you said it's important to be consistent with what you're saying. And we've also been talking about this idea that sometimes there's some modifications necessary depending on how the athlete is progressing or the need to adjust things. Is there a contradiction there, or like how can you be consistent with what you're saying to the athlete, but also sort of so that they trust you, but then also modify the program as you need to? How does that work?
Yeah, as you say, it's not easy to do it. Um, my idea is always that we are the probably the less important character in the most important character is the player, if you're talking like a movie.
Mm-hmm.
So for sure my role at the beginning of injury, it will be, we can say, more important, but this is not because it's just because the player has to understand and to create, to understand some KPI, some important point of the rehabilitation, and he has to be guided at the beginning. Uh, After the first phase, for sure, starting with making independent, it will be um, much more important for him in long term. We can say, we can say that the trust between us is going to be more short term, and to be more independent is going to be the long term process. So you have to integrate and cross these two way, we can say, to empower the athletes to create a resilient athlete, and we can say it's our job
Yeah.
to dosify and modify which way you have to use it, because only using one or the other, for me, you're gonna fail.
Right. So you don't want to be like at the beginning of the rehabilitation, the physical therapist is quite important in guiding the process when, maybe there's a lot of uncertainty or there's pain or, the initial kind of symptoms of the injury. But then as the rehabilitation progresses, then it's important for the athlete to assume more independence or responsibility, or for them to be empowered. So
Exactly.
kind of just balancing those two, it's, from what I understand, sounds like that's important part of your role.
Yeah, sure. And also what and daily job is to make them as much as possible integrated with the team. This doesn't mean release the athlete is gonna be the coaching staff to take care of them, but mostly for the long-term injury. As soon as the athlete is starting back to the training, normal training session, I think that for the first part, it needs some time, depends on the athletes, obviously, but sometimes it's better to make them separate completely from the team. Maybe sometimes they need some weeks to reset completely mentally. And then after, slow, you can start to share something because, for example, what is say one of our colleagues, rehabilitation is just training during injury.
Mm-hmm.
Is a great sentence. And
Yeah.
at the same time, as soon as they have ability to do something, and we know mostly for not only for the young athletes, but also for the professional player, if they can participate to the normal routine of the team, it will be different for individual athletes, because individual athletes are always individual if they are in injury or out of the injury. Yes, maybe they can have more contact with the coaches, but even if he's individual athlete, the coaches have always a direct feedback from you. But in the team athletes, in which they need to breathe the locker room, the colleagues, the mates, with the small things, is nice to make them to do it. Even some small part of the training, what they can do at the right time, correct? We have not to accelerate nothing, just to just for this. No, is opposite. So as soon they are able, it's like it's not a reward, but it's a way to involve all the other stuff. And at the same time, athletes could be starting
Oh, sorry, the last part just froze there for a sec.
yes, a little bit. Yeah, we're just saying that put the athletes a little bit in some part of the training, some part of daily routine with the teams. It will be positive. He continue to see that he's achieving something. He's starting to be closer to the return to training, and then to sports, and then to play. Obviously, you have to take care about this information, because with some athletes, as soon as you give some positive feedback, they already think in the next week they starting back to train fully. This is one of our big challenges in Aspire.
Mm-hmm. So on that note, and there's a few things I want to pick up on there. I really like that phrase that you mentioned. Your colleague said that injury is just, or rehabilitation is training in injury. And so to me, that kind of implies that there's still kind of keeping that sport and athletic mindset. And you mentioned this idea of routine several times. So there's still sort of, the notion that, okay, it's not that you're not doing anything now, but you're engaging in training. Maybe it's modified training, but you're still doing all the things that you can be doing to get back and compete at a high level. You're still training. It's just
Exactly. And another big, for me, important things is to translate and to transport injury from a medical condition to a sports condition.
Mm-hmm.
So even in this case, sometimes it's better to take it out this idea that if you are still with the physio, you are still in the medical room, you are still injured in your mind.
Right.
So transporting this, you're gonna be helpful to athletes to move out from this fear, anxiety, they may be still present a little bit, and make him confident and starting to go back.
Right. So I think that's a great point, really interesting. If the athlete, you're suggesting, if they're kind of in the medical environment, maybe a lot, or particularly, I guess, for a more serious injury, then
Yep.
they're more likely or more prone to think of themselves as still injured. Whereas the more they're able to, you mentioned being involved with the team environment can be important or beneficial. That would it be accurate to say that that involvement with the team also helped shift their thinking that, I'm not so much injured, but I'm more just, as you said, training and rehabilitation, or I'm still doing kind of modified training and I'm still an athlete. And yeah,
Yeah.
I don't want to put words in your mouth.
No, it's perfect. What you say is perfect. We have to say also that from one side, as you say, we can shift from negative to positive. When you say, if you are in the medical room, if you are, we can say, completely out of the team, there is the time to reflect on yourself, reflect on the injury. And this probably for me is positive to stay in this position for the beginning. And then from there, you can be, as we told before, with our role and all the other health practitioner and coaching staff is to take it down from this medical thinking and put in the team and progressing with the return to train and then playing sports. So another thing that is nice for us in academy, because we are all in the same place. So another part that we say for me is important. A part of the, you are not, you can be out of the training, you can be out, but in 5 minutes, the coach can come to you and say a word to the athletes. This is very important. So they can still be part of the environment, even if they are not part of the team in the moment.
Right.
And this for sure is gonna be very important to athletes to understand they are not alone in the
Yeah.
process.
Okay. So that isolation that can be sometimes part of the injury experience sounds like that's mitigated or reduced because of the environment at Aspire, where maybe the physical therapy room is close proximity to the where the athletes are training, so they can still kind of be in and around that training environment, and that's helpful.
Yeah.
You mentioned, Marco, this point about athletes uh, or injury giving an opportunity to reflect and to kind of analyze, and I'm wondering if there are benefits to the injury experience for the athlete, or is it just a negative experience?
I can say probably most of the time is negative, because depend on the injury, the world is collapsing,
Mhm.
because you have some as a normal athlete, you put some goals on the year. Maybe you say, this time I want to achieve this, can be a local, can be international level, could be your normal pathway, and suddenly is interrupted by injury. So you have to rebuild something. Sure, it's going to be easy for students or athletes. They have already have small injuries before, so they know already how it's going to be. It's very difficult, and then sometimes happen that the first injury is going to be major injury. So you never had nothing, and suddenly you have to be 6 months out. And this is gonna be very, very tough for the boy to understand. And we have a lot of challenges, maybe sometimes out of our responsibility as physiotherapists, we can say. So sometimes it's better to, as I tell you, sometimes it's better to just to reset. Maybe sometimes they have to pass more time with the family, refresh, and then they can start again. with the normal pathway. Sure, it's gonna be most of the time difficult, but I think that with some kind of athletes, and probably this is probably brutal to say, but is a different for a probably elite athlete and not elite athlete. If you already find some of the sign, the way to put immediately in positive something that was negative, like injury, could be
Right.
probably a determination for to understand if you are in front of probably a elite athlete.
Okay. So the more, a few points, it sounds like overall the injury experience is a difficult one for sure, and it stops athletes in achieving goals that they had set out for themselves, but that there may be some opportunity to use it to spend time with family, or just to recover or have some time to reflect on their sport. And sounds like those are positive things. Marco, you were mentioning that elite athletes seem to be able to kind of find the benefits maybe more easily, or to kind of regroup.
Yep.
And I'm wondering if there are any factors that you think distinguish athletes who are able to make a successful return versus those who seem unable to do so.
Sure. What I found it in elite athletes is more important when they are individual athletes, individual sports athletes, because already the individual sports is meaning they are alone in the team, a part of the coaching staff, and then all the other figures they are supporting. So sometimes maybe, because maybe, for example, in athletics, in other sports, that you can decide your season, you can put your goals. So maybe it's more, one side is more easy, but at the same time is a sign of, one can say, some of the intelligence of the player and the coaching staff at the same time, to say, okay, we have not to run. We can postpone this achievement. We want to achieve this year. We can postpone this of 6 months. We're gonna work in these 6 months in other things. We're gonna increase the fitness. We're gonna work on the technique. We're gonna work on other things, and then we can be ready to coming back and restarting again. So the period that is gonna be the injury is not gonna be a lost time, but it's gonna be just changing a little bit the scenario, changing a little bit the pathway, and then be ready to starting again, probably stronger.
Maybe you can elaborate or clarify, like, how is that ability to kind of focus on the things that, areas that one can improve on or to modify, how is that related to their status as an elite athlete, or whether they're in an individual versus team sport?
For example, for individual, we can say the one of big risk for the injury in general, for me, is in this age could be two things: re-injury, and sometimes the re-injury is gonna be much tougher than the other one in this age, specific age, or could be also the dropout of the sports. So this probably between elite athlete and not elite athlete in the individual sports could be also this, because if you decrease the risk, the two negative outcomes coming is already to create a mindset from elite professional players.
Mm-hmm.
For me, for this part.
Right.
Talking about the teams, is a little bit more difficult probably to differentiate and understand some abilities for elite and not elite athletes. But we have to say that the team sports, for example, in football, you are part of the team, you are part of the group. And be part of the group, you're gonna influence and receive influence. So if you are able to, after an injury, coming back in the group, and talk about your, I mean, not talking, but show what is changed as before, and then you are able to coming back is a proof of be solid and be consistent, and it's going to be affecting in a positive way all the other members of the teams. So if you are able to do this already in young ages, I can say can be a sign of the elite, could be mentioned like an elite athlete.
Right. So when you talk about elite, are you referring to an older athlete, or could you still be elite at a younger age?
Okay, this could be a little bit different because, for example, in a lot of these sports, Olympic sports, we are talking the last times with some professional athletes, they already always mention that the youth categories, so can be under 20, under 18, under 16, are completely different world from senior athletes.
Mm-hmm.
So this is important thing that they have to say, that to be an elite young athlete doesn't mean that you're gonna be an elite, for me, an elite senior athlete.
Sure,
because
sure.
the sport is gonna be different.
Right.
It's gonna be different. The task is gonna be different. Probably the rules, the time, and the ability of the other players that you have to face.
Mm-hmm.
I think we can separate the two. So between senior athlete, senior elite athlete, senior athlete, and in youth elite and youth not elite athletes, because then it's gonna be completely change of paradigm between the two main categories.
Mm-hmm.
But on the other side, I think it's very, very difficult if you have a senior athlete, elite athlete, has to be built in the past.
Right, right.
So,
right. So, the younger athletes who are able to kind of overcome some of these challenges associated with injury, that can be maybe helpful as they, progress into a senior elite level. You talked earlier, Marco, about athlete expectations, and I just want to come back to that point. What impact do athlete expectations of their recovery have on the recovery itself?
Sure. One of these, it is gonna be the easiest one. Is gonna be to be faster in the recovery. So because we discussed before, they have the tournament and they have something they want to achieve. They want to be fast as possible and go back there. And this is gonna be harmful from two sides. So they have to understand that there is some specific timeline that we have to respect from one side, and some criteria timeline.
Mm-hmm.
I'm one of these more than happy if you achieve some results in the rehab process, then we can move forward. We are moving, luckily, in this last years of research and evidence-based result, to move from time injury to criteria. So to move from normally you need this amount of time, because we have to say that some of the players, elite or not elite, they have different time to learn, and second, to recover. Someone could be faster from some aspects, and other we have to be slower.
Mm-hmm.
So this is why probably the criteria return to play that could be applied for rehab can be applied also probably for psychological factors, more than normally you expect to have this time. So what I say, normally what the boys are expecting is to be faster, because as we already say, we are always thinking about the small term, short term.
So does that require a shift in the athlete's mindset, going from their expectation or their focus, as you said, is on time, right? They want to get back as quickly as possible, often for a specific competition.
And also sometimes there is this mistake that is normal probably a part of the our environment, that if you are faster, you are better in recovery or in other topic.
Right.
It is not always the correct information.
Right. So sometimes there's this perception about, that the stronger or better athlete is the one who's able to return faster. And, that if you're a good rehabilitator or recoverer, you're one who does it quickly. And
No.
it sounds like you're suggesting that's problematic, or that, in physical therapy, there's a movement towards more of a criteria focus rather than a time focus.
Yes.
And so that the athlete has to meet certain criteria or standards before they can return. Is that correct?
Correct. Yep.
And so is that, I guess my question is that a difficult shift in the mindset for the athlete to make from one focused on, well, I want to be back for this time, to a focus on, I need to meet certain criteria before I return to play? Is that
Absolutely is absolutely difficult, and but also put inside criteria, you can make them understand they have to achieve, they have to be, you can use the short term that they are not they are normally expected to think about, and you translate in your part of the rehabilitation process. So you can transform some negative pattern in a positive pattern to make them focus, and then also to engage them in
right?
the rehabilitation process. Because if they are able to do this, they understand that we are both in the same pathway. We are always all in the same railway. We are going in the same car in the same direction.
Yeah.
So it's difficult, but probably is gonna be at the end a positive outcome if you are
Right.
able to translate this.
Okay, so you use that term pathway, and I guess sort of the idea of criteria, it seems to me, is consistent with the notion of goal setting, which athletes are
Exactly.
used to doing all the time, right? So if they're, and you also mentioned it kind of helps focus their attention. So I imagine if, those criteria then are broken up into a pathway or certain steps, that it sounds like that's actually helpful to the athlete and something they can understand.
Correct.
Okay.
Yes, and we also have to say that another thing is important is a translation that we can take from coaching staff. Coaching staff, they are development player. They are not teach the boys and coach the boys to winning in this time.
Mm-hmm.
Then if they're gonna be able to win, it's gonna be a plus. But they have to create athlete is gonna win in the future.
Right. So you're also trying to emphasize to the coaches that, I guess, for the athlete who's been injured, maybe, I guess, particularly for a more severe or long-term injury, that the focus should be about, not so much on winning, but about other, I don't know, skills or other things maybe.
This is why to explain the same probably bigger time to achieve some result that could be in the coaching time, in the coaching, so in the training session, but could be also in rehab.
Right.
So is to create patience in the athlete, because this could be in both of the directions, so both in the medical part and also in the sports part.
Right.
So taking the mental mindset of the coaching staff and translating him in the same in the rehab process.
Mm-hmm.
We are doing the same thing with different. We are talking a different language, but we are doing the same thing.
Right. Okay. So trying to kind of create the patience, whether it's with the athlete or the coach, and emphasizing kind of those criteria or the need to heal, that kind of thing sounds like it's important part of your role. Maybe you mentioned pain a little bit earlier, and maybe you can just talk about some of the either the physical or the psychological aspects of injury that may be painful to the athlete.
So sure, pain. pain is gonna be important, very important key point in rehabilitation, because mostly, for example, in our experience, most of the, I can say 99% of injury they gonna be, for my assessment, is gonna be due to the pain.
Mm-hmm.
Not because I'm not able to do this or not able to run. I feel something that is not. I will expect this from senior athletes. So the own body perception and awareness is much higher, and this is another thing that we have to build, like education, to start to understand the youngest boy, which is a positive pain, which is a negative pain, which is a momentum pain, it's going to be an overuse, acute. There is a lead is challenging at the beginning, and also for the language, it is difficult. We can say the pain in our environment is quite overestimated, we can say. I mean, the boys over present and over describe pain.
Mm-hmm.
So it's difficult to put in the cluster of some scale of pain, because they're normally exaggerated.
Uh-huh.
So this is why in the education part is very important to make understand them, mostly the youngest, with some metaphor. Could be funny metaphor talking about pain, but it's clear to understand what is, for example, the typical 3 of 10 or 6 of 10 or 9 of 10 of pain, what is really meaning. Because if not, we still talking two different language, because they say something and you cannot understand, and you're talking and they are not understand.
Yeah.
So the question of pain is quite important for this part. And for example, when you have some athletes with a big injury, linked with the pain is the fear avoidance. Because for example, after you are in the crutches, you have to put again your weight bearing, for example, in the foot, on the knee. It's gonna be difficult to make them understand that they have to feel some pain. That pain in this part is gonna be positive, because it's not the pain they have suffered before, is a different kind of pain, and they have to progress on this and they have to be resilient in this case. They have to understand what is pain, and be a little bit more less and a little bit less easy to
it.
sensitive, exactly.
Yeah.
To this one.
So
And linked to this,
sorry.
I would say probably for the psychological side could be the resilience threshold, depends of the athlete, could be lower probably,
Mm-hmm.
because of the pain, because they don't want to feel again the same kind of pain. So they want to starting to push them less and less, because they don't want to move out from this. This is one of the key point that you have to probably to take in consideration when you have a long injury or after an injury, because kinesiophobia, fear, anxiety, there is a lot of emotion in the athlete. Probably also maybe if they have surgery is, we didn't talk now till at the moment, but surgery, if you never have experienced any kind of surgery, is going to be a tough moment for the athlete, because sure, for the surgery is going to be some time loss, and then you have to be strong mentally.
Right.
And
So
be
just to clarify your last point
sure.
there, are you suggesting there's some reluctance or ambivalence for athletes to, they don't want to experience certain kinds of pain, and so maybe they're hesitant to engage in certain rehabilitation behaviors? You mentioned kind of like they're on crutches, and then maybe they need to learn how to walk again, and that will entail pain. And some athletes, they don't want to experience that pain, so they sort of avoid trying to engage
Exactly.
in that movement. Is that right?
is correct. And also another key point that we have to talk about is social media attention. I
Mm-hmm.
mean, talking about injuries, for example, ACL injuries, that is one of the most famous in the sports, mostly in football. They is no more the period of 10 years ago. Then you have to reach the information. Now the boys, they can YouTube, they can Google it, they can knows everything around the world, and they know that athletes, the elite athletes, they recover in 6 months. The probably is not the correct based on the evidence now, and so it's difficult to them understand. They have to wait for 9 or 10 months because they are different. They have different surgeries, etc., etc.
Right.
So it's difficult to translate, to transport, and cut this link, because the boy, they can immediately check everything.
Right. Right. So
Even
there's
if they have a X-ray or imaging, they're gonna immediately check which is the muscle they have it, in what is gonna be the rehab, and probably also challenge you.
right. So there's a lot of information available, of course, with the internet, and you're indicating that maybe sometimes that information is less than helpful because who knows where they're getting it from, or but
Exactly.
nonetheless, it can have, it sounds like, a powerful impact on their expectations or what they think they can achieve. Also,
Yeah.
as you were talking, I was thinking about paper that I read where they indicated that I think for athletes under 17, if they came back after ACL injury before 9 months, that they were significantly more likely to have a re-injury than
Correct.
those
Absolutely correct.
waited after the 9 month period. So,
Absolutely.
again, I guess kind of managing those expectations can be
And same,
challenging.
one step before, they have injury. You can say injured. There is something up in the knee, maybe playing some contusion or something. If they hear something, or the something is not going as expected, they already mentally thinking about the worst scenario, and
Right.
based on the worst scenario, they're already thinking they are already out of 6 months or 7 months, 9 months, 10 months. So
Mhm.
maybe sometimes it's difficult for us to, because they overreact of the pain, because there is already one mental process is already starting 5 minutes ago, because they have the injury 5 minutes ago, and you're assessing later before of the social media, because then after they're gonna, okay, uh, if they clarify they have the surgery, they need this kind of, or this injury is clear diagnosed, and then they starting to look in social media, looking in the internet, and then they starting with the second thing. So it's difficult to, and it's our part of our job to stop immediately this reasoning, and this again linked with the trust, and etc., etc., etc.
Yeah. So, again, there's forces, I guess, related to information and all this social media that sometimes can be difficult to manage, it sounds, in your role, and
Yes.
coming back to that education and information. And again, part of the reason I'm interested in having conversations with experts like you is to try and put out some content and material that's based in people with credible training and scientific backgrounds and
Yep.
proper training. I also thought it was interesting, Marco, that you mentioned the importance of athletes being able to distinguish pain, right? And you said that some pain is almost good pain. So this idea that there may be necessary pain that athletes have to kind of work through as part of their rehabilitation, versus some pain is maybe more harmful or sinister, where it's maybe a sign that they're injuring themselves further if they keep pushing it, or in the
Sure.
case of chronic injury, that maybe, okay, I need to stop backing off my running because I'll get a stress fracture, or so I thought that was an important point. And
Sure.
how do
There is a,
athletes develop that skill?
it's very difficult, and it's very important for, and probably I can say is one of my main tasks close to the education, because athletes are 12 years old. We have to think that they are not able to achieve a high level of performance in this period. They difficult to go in the heart rate zone, and it is very challenging. So they are in the growth related spectrum of injuries. Based on the first sentence, so they don't know when they push too much or they push very low.
Right.
And so they're not able to understand if it's a stretching pain, if it's a daily pain, and then day after is nothing. That could be or opposite. They are very strong, they are very proud, and they won't say nothing, and then you find they had some pain since 3 or 4, 5, 6 weeks. So it's difficult to, because if they report any pain, every pain is gonna be all the day. If they report so only massive pain, you're gonna maybe find it very late in during the session. This is why I'm always a fan to not be always present to the training session, because it's quite clear that the presence of the physio is gonna immediately overcompensate for the pain.
Mm-hmm.
Sure, there is much more possible that some pain getting present when the physio is there, because they saw me, they know which is my job, and so they mentally there is already this thinking that, okay, maybe if I have some pain, there is already here, and I will go directly through him. If
Right.
I will not present in the training session, even because sometimes they are lazy because maybe it's too long to come to me, so the pain is gonna be disappear because they don't think about it. Or opposite, another part of the education is because sometimes they are always complaining about pain, and then after, maybe when they realize this pain was important and needs to be taken in take care, say, okay, but so I have to miss this training, I missed this tournament, I missed this game, and so then they regret to point it out, this pain. Right. So it's quite difficult to make them understand what's going in the pain. There is some strategies they could be just maybe delaying the new assessment. So make them like, I will see you tomorrow. So we're gonna see if something same education, explaining what's going on, doing some test, even if it's not a relevant test, but just to reassure them that you are taking care of him, you are on top of them. And then say, okay, I don't see nothing particular. We see next week, day after, or if it's the end of the week, we see beginning of next week. And then you have to be rely. Tell me what's going on, if it's something changing, etc., etc. Mm-hmm. And normally I will make them independent on this side, and starting to understand and not ask to the father or the mother or someone else if their pain is important or not, but try to listen their body and say, okay, do you think that today you can do something? Yes, maybe I think, okay, maybe we're gonna modify some part of the training session, but we try.
Right.
So
sometimes you're asking the athlete directly to kind of listen to their body and not necessarily to speak to their family members, but just to kind of think about what they're experiencing, and then maybe come back to you in a day or two or whenever and discuss what they're feeling. Or
yep, because one of the big challenges that we have, I have with my athletes is, and I can understand them. They come for an assessment. They say, I have pain in the knee, and say, and sometimes I will be quite brutal. We can say sometimes say, and so, they only have the answer of pain, but they don't have the answer like, yes, so I'm not able to train. No, but I have pain, but I could train. So they always expecting that we are the one they say the answer. And this is why sometimes I'm playing with them just to understand which kind of pain is it, how much is it, but mostly to understand what they want to do.
So
because I
sometimes,
missed the last part of the link, because it's easy to say I have pain,
yeah,
but for me, give me is part of the assessment. But
right,
I don't know if you are not able to move it, you are not able to do this. I want to take some responsibilities on this and say, okay, I have this pain, and because of this, I cannot train at the maximum of my effort. I
right,
cannot score a point. I cannot do this. I want they try to be responsible and explain me more than the easy one that is gonna be, I have pain, and now it's your job to solve the issue.
right, right. So sometimes there sounds like there's a tendency of the athlete to try and put the onus or the responsibility on you for telling them what's wrong with them or
Exactly.
what the source of their pain is, and what they shouldn't be able to do as a consequence. Whereas you're saying you try and put the responsibility back onto them sometimes, and say, okay, well, explain to me how this pain is affecting you, what impact is it having, and kind of what do you think you're able to do or not do. Is that right?
Exactly.
Yeah, okay. So it sounds also like there's a lot of conversations kind of back and forth with the athletes to help them, again, sort of become more independent in pain management, or just differentiating those different types of pain and what it means, and helping them develop the skills to know when they should continue working through it or when they should back off. Um,
Absolutely. Absolutely.
yeah,
Yes.
okay. Um, so those are some great strategies. You kind of addressed one of my questions about what are some ways you help athletes manage pain. So that's perfect. Are there, I know you said injury can be a very emotional period for athletes, and I'm sure, you're a physical therapist, but I imagine either you see or hear athletes maybe express negative thoughts, or maybe you witness negative emotions, or they express negative emotions, or maybe you see that in their kind of their body language. Are there ways that either strategies that you use or strategies that athletes could use in your experience to
Um,
manage those thoughts and emotions?
sure. I think I will summarize some of the points that we already discussed in other questions.
Mm-hmm.
So for sure, the role of the family is gonna be important. So they need to discuss and share with the family, because it's gonna be relevant part of the process. So for sure, they gonna part of this. I think another issue could be, as we already say, um, create intermediate goals. So goal setting is going to be very important to cancel as is not cancel, but delay as much as possible the impact that negative thoughts are going to be have in the process of injury,
Mm-hmm.
and at the same time of the part of the training session after. Um,
How
Other strategies.
how or in what way are is the goal setting process or exercise useful in kind of managing negative thoughts or emotions? How does
I
it
think
help?
because uh, achieving results, achieving criteria, they're gonna help the athletes to move out from the negative thoughts and go in the positive thoughts, because they see positive achievement.
Right.
Sure, this part is gonna be important, and as we say also before, at the same time, maybe be part of, maybe with these athletes, they have already negative and thought in general, uh, as much as possible integrated with the team. The integration with the team could be also, because for example in the first part of the treatment, maybe you don't need to work all the time with the athletes, I mean all the session that is dedicated. but they can stay in sitting in the bench and stay with the friends and stay with the and at the same time doing some learning, just only watching the training session.
Right.
So I think this one we have to modulate and differentiate between athletes, and if they already some negative thoughts and feelings. I think for sure the role of the psychologists that we have also here in the academy, based on obviously on the gravity, not gravity, on the seriousness or the severity of the, we can say, the emotional feelings that the athletes has, is going to be very, very important. And we know, and you know more than me, that sometimes it's difficult to pass the important is for me is massive of the psychologists, because they always they thinking about that something's not going on as going well with their mental aspect. That is not true. I think the in what I saw in academy, the role of the psychologist is gonna be massively useful when we move for the performance groups and the target athletes, because they are used to have in the past with some with the probably with the same psychologists, they already have some chats, I mean some meeting before, and then it's gonna be much more important, and then it's gonna be with all of the different components. They could be for the return to play for the after the injury. That could be talking about issues regarding the family, so personal things. That could be performance. That could be a lot of other aspects.
So there's a range of concerns that the athlete might have about their recovery, about family life, about their return to sport, and having the sports psychologist to speak to sounds like that can be useful or beneficial from the athlete. So you've talked about this through your response just now, but I want to ask it explicitly. What are some of the specific types of social support that an injured athlete needs?
We can say internal, external. External, I will repeat for probably the 1,000th time, that the family is massively, at least in this kind of culture, is very important. So there has to be the support around the player. This is the external, for sure, support. And the second, we also to think that the boys normally, they stay all the day in the academy. I mean, from 6:30, 7, they start in the school till more or less 6:30, and then they have to back to the home, so they can join family only for the dinner time and then go sleep, and then they start again the academy. Someone is staying in the academy to sleep, and they come back only in the weekend. So the role of the family is important, even just because they have no time to spend time with the family. Mm-hmm. So they have to, and it's the weekend and the nighttime is the only time they can spend. So this for sure is going to be the support they need.
Right. Do they always get the support they need from their family, or are there instances where sometimes the kind of what's deemed supportive from the family?
I think we can find the same scenarios in Europe, in US, in other. Sure. So they are family, they are supportive. They are family, they are cohesive. They are family, they are even more separated. So depends on which is gonna be the figure with the boys living normally. Yeah. And for sure, in the internal aspect, I can say the coach is very important as a support. Mm-hmm. Because they spend most of the time with them. They trust them because they are the figure, they are creating their career in their sports, in the sports. And so this is very important sometimes. And it's very important is the coach is referring the athlete or to me or to the sports psychologist because he saw something was going on. For sure, the school and school in the two direction. I mean, school has to support us, and we have to support the school, because sometimes teachers and principal, they have not have all the instrument to understand maybe what's going on in the sports activities and what can affect the school, and opposite. Maybe there's something going on in the school, exams, or they have some fight with some teacher, or they have some issues. So this is gonna be reflecting in the other side.
Mm-hmm. In terms of the coach, what are some things that the coach can do to support the athlete that's helpful?
Sure, they are the masters of in the sports and the technical, probably technical abilities. So maybe sometimes athletes are not performing well. They are the one that maybe they have more power to reassure them that is maybe is part of the process. So they have not to desperate. They have not to be angry on themselves. They have just to. This is a transitorial moment. They have just to keep calm, and then if because the other part is and is part of the important part of the coaches is maybe the athletes are training very well, they are putting maximum effort, but they are not achieving what they supposed to. So the role of the coaches has to be transparent with them and to explain, and then maybe keep them could happen in this part of the period.
Right. What could happen? It cut out. What could happen?
Sorry?
Sorry, the screen froze. You said something could happen.
No, this could happen that they can train at the perfect. There is no any negative issue in their training, but maybe they are not able to achieve and then transport this in the competition time.
Right, right.
So this is the most important, because the athletes say, okay, I follow your rules, I follow your training session. I'm see that I'm progressing and I'm getting better, but there is not this part is developing in the competition time, because I'm losing the focus, or I'm not. So it has to be the role of the coaches to obviously be transparent, but explain and keep them motivated that could be something only for this moment, and it could happen. It was I saying, this could happen in your career, that you are doing very good, but you are not able to succeed. Or opposite. I think the opposite is gonna be the real role of the coaches, because maybe we have the athletes, they are winning, they are competing, they are achieving results, but they are not doing the right way. So this is gonna be difficult to coach say, you are doing wrong, because we have to do other things to be elite, to be consistent, and the athlete is gonna be always answer, but I'm winning, so if I win, I'm right. So this part to support.
Right. And so in the case of injury in particular, you mentioned the coach helping the athlete stay calm. Sounds like maybe providing reassurance, or kind of just listening to some of their concerns. But the coaches, it sounds like an important role, given that
Absolutely.
that they're responsible for the athlete's career.
Absolutely. And this is why we are always keep them involved immediately when we talk about serious injury, involve immediately the coaches, because first they're gonna give us the pathway that the athlete has in this year. So if we can delay, if we have to, it's gonna be better to accelerate some component of the rehabilitation because of the couple of things. And for sure, the trust between the medical side and the coaches is gonna reflect to the boy immediately. Right. Because if we are not in the same page, the athlete is gonna feel this not connection, and then it's not gonna be part of the process, and it's starting to be tricky in the
Right. So again, it's important to be for all parties to be on the same page and for the athlete to feel connected to their coach. And I imagine, particularly during injury, there may be times where athletes feel less than connected to their coach.
yeah.
I just have a few more questions, Marco.
Sure.
Thank you for all your wonderful comments and insights. Are there, or maybe you can talk a little bit about the role of motivation and its relevance or importance for athlete recovery?
Sure. I mean, this is not only in rehab process, is in training session. If you are not motivated, if you, as we told before, talent is not the only stone of your career. There is the hard work, and there is the mostly of motivation. That is part to make you achieve the best as possible in your career. That could be high level, but it could be on even in normal professional level. For sure, if you are motivated in the rehab, I think there is tons of studies that's gonna they talking about they write about this. For sure, athlete is motivated, if he's engaged in the rehab process, for sure is gonna be quicker, but not in question of time, but quicker to achieve immediately the quality of the that we need.
Right.
And how can I say?
So when you say quality, do you like in terms of like effort that they're putting in, or they're just doing?
Yeah, I think both sides, even the quality the athletes they can, and so you mean the effort, correct? But I think also to be a consistent rehab session, we need to set a couple of goals. That is the minimum requirement, and as soon as the boy understand what is the injury, what is the process, and he's put his motivation because he want to come back, because he want to come back stronger, he want to come back quicker. So you have to put this effort, shape it a little bit, cut the wrong angles, make a good circle, and then going on this. I think is a key point. Absolutely.
Yeah. Okay. And in terms of decisions about when an athlete is ready to return to play,
Yes.
how do you know that the athlete is ready to get out and start competing again?
So for sure, the readiness of the athlete is probably when you arrive to the return to play, return to sport, is the same value, the same amount of importance that the biological aspect, the physical aspect. We see a lot of athletes, they are with good strength, with good flexibility, good mobility, and good starting to have some performance tests are okay, but they are still not confident because they still have some fear, some small anxiety of some something that is not going on properly in his knee, or still they feel that is different from the other one, or is still different from before the injury. For example, there is one scale that I use it for the ACL. That is keeping in consideration the psychological factors. So
Right.
this is a good scale to understand. I use it also for other injuries. Not only for this, I modify a little bit the questions.
Yeah.
I use all this because it gives you some idea. I mean, at least you know when he is gonna be not ready. So if you have some value that is gonna be, they alarm you, okay.
So you get information from certain questionnaires that you give the athlete. I think
Yeah,
I know which one you might be referring to. Uh, there's one, I think, by Dr. Kate Webster, looking at readiness to return from ACL injuries. I don't know if
exactly.
that's, and yeah, kind of assessing psychological readiness to return. And so it sounds like you use some of those scores, or I guess my question is, how do you use those scores?
Yeah, I will use it just to have one input for myself to understand in the rehab process where I am.
Mm-hmm.
If I have to do some step back or some step forward. And in the case that we have to do the return to play and return to sport and return to play, in which is a holistic decision. Holistic, it means I'm not the only one. I'm give my part of return to play, but there is other person they have to help me. So the doctor, the coach, and the SNC and all the other figure, the psychologist and all other figure, because is a thing is decision they have to take is a decision making, shared decision making.
Right.
Absolutely, absolutely. I can in probably in return to training is probably I have a big percentage in the decision with the doctors, but then after probably mine is gonna be decrease and the coaches and other things. I think the last how can say actors in the decision making absolutely is going to be the athlete. No, the first one is going to be the athlete. The last one you can say is going to be the coach, because the coach will help you in define which is going to be the return to play.
Mm-hmm.
Because if you are in a professional player in professional sports, maybe you need to have the athlete to win the championship or to win the league, and then you have to modify some requirements to be faster, we can say.
Mm-hmm.
In the other side, say, okay, no, listen, I next top tournament we need is gonna be next year. So take your time, non-accelerate, go further to what you think about is the best one, and then I want a gently progression.
Yeah.
Or there are other coaches, they would like to have the athletes in full training only when they are 100%. They probably could be in probably mostly in the individual sports, but it's not so particularly true. Other instead, no, as soon as able to do something, I want to be there, because some of the technique of some sports, you can do it when you are injured. And at the same time, you can build the performance, and then you can arrive to the discharge the athlete.
Right. So depending on the coach, for example, that you're working with, there may be different preferences about the athlete's level of involvement, you know,
exactly.
Yeah, related to where they are and how much the coach wants them to do or not do. But it also sounds like there's times when you mentioned the athlete may be meeting physical criteria, strength, proprioception, those kinds of things, endurance.
Yeah, because maybe in some sports like maybe football, that maybe is gonna be probably easier for SNC physio to put some step and some goals, and mostly the coaches, they need to know when is able to participate to the training session and which level, or if he still have to do some modified session.
Yeah.
For example, other sports where the technique is more important could be, for example, fencing, could be um, or even the racket sports, when to have the feel of the ball, the touch of the ball. If you stay a long time without not touching the ball, you lose this confidence. Maybe you need the coach need, okay, even if he's not able to do this, but if he can stay with me to do at least this part. So this is why we talked before about to give the players as soon as possible in the training session with the limitation they need in the time, because maybe they can still work in some part of the technical side of the sports, so it will keep there is not to lose, because then you're gonna need more time to recover this part.
Right.
And second, more generically, we can say we have not to say no, we have to say yes to the athlete. So find solution, not find problem.
Right. So it's important to integrate the things that they need to do or the skills that are required for return to sport to whatever extent into their rehabilitation, and also to kind of find things that, again, that they can be doing so that you can say yes as much as possible rather than no.
Exactly.
And I just want to touch again on that kind of point you said about assessing their psychological readiness, whether it's through a questionnaire that you use or
Yes.
other means. Would you say it's important for the athlete to be psychologically ready before they return, specifically, let's say, to competition?
I had some athletes, they probably did not say in this way, but they asking for this. I mean, they say, I'm not ready to come back to the training. I feel that I'm still something is going on. And they are obviously are not able to say clearly there is some more psychological issues or can be physical
Right.
issue, but I am absolutely put there in the return to play, in the return to sport, the same consideration of my job with the psychological aspect.
So you
Because
would say the physical readiness and the psychological readiness are equally important, or I don't want
yeah,
to.
absolutely, absolutely. Maybe in the first part of the injury, maybe we have more job to do at the beginning for the physical part, and the psychologists can help to guide the athletes, but not maybe not still talking about the readiness because it's gonna be long.
Yeah,
But when we are going close to the return to sport, return to play, is for me is important.
yeah. Are there signs or indicators that an athlete is psychologically ready, or maybe that they're not ready to return to play? Signs of their their state of mind that you can observe or determine in some way.
The good things, that is gonna be a little bit more subjective than more than objective, is that some of the players that I following from this grade 7, it is the first year they are in academy. After 1 year that we are all together, you starting to know which are the characters of the boy, what they are, their strength point, the weakness point, if they are tricky boys or are the honest boy.
Mhm.
So this party also you can reflect in rehab process and psychological factors,
Right.
because you know more or less, you see acting, way they act, what they think. Even sometimes we have some small talk because we are the first, we are the person that we spend more time with them. So they have to also to enjoy the part. So they're gonna be jokes or can be talking about everything in general.
Right.
So it's quite subjective, but knowing the players and the coach that are spending more time than us during the year, these are the first person they can help you to understand that, okay, no, this boy is quite a liar, you have to be careful, or not trust this boy because whatever he said is gonna be the reality. So he's gonna help to translate this in the real process, and when you return to play
Yeah.
and see when they act and see way they're moving, the face they are doing, how they talk,
Yeah.
and this help with the questionnaire or the psychological assessment,
Yeah.
so done properly by the psychologist, is gonna be matching together, and you can have a readiness for the
Right. So it sounds like you're kind of triangulating where you're, using multiple sources of information, whether it's your knowledge of the athlete through your
yep,
interactions over rehabilitation, their behaviors throughout the recovery, their movement patterns as you see them engaging in sport specific skills, knowledge of the coach, and maybe getting input from the coach on the athlete's tendencies, and kind of using all that, or what the athlete is simply telling you and
yep,
saying. And using that information to then sort of build a picture about whether the athlete is ready to return or not.
Sure. And then we have also not to forget that the psychologist is doing normally, depends on the coaches, depends on the sports, is doing normally a year project with them, so with some team activities, and sometimes also some single activities out of the injury spectrum. So it could be maybe how they manage the angriness, how they're angry during the training session or during the out of the training session. So we have already also some other indication from out of injury aspects, and then keeping that to transporting the normal activities.
Right. My last question for you, Marco, is if you were to share one piece of advice for injured athletes, what would it be?
This I've written it before because I don't want to say, I want to be clear. So I think it is very important for the athletes from now, it's not talking about my environment, but it's going to be a little bit more out of my environment, is select, discuss, but at the end, trust your staff. So I think the athlete is important to select. Some depends, because if you are professional individual athletes, you are probably the one is selecting the coaching staff or selecting the medical staff and selecting the physical staff. So you are able to select. So it's good. Because it's gonna be the person that is gonna be helping achieving result. You have to discuss with them. So you have to challenge them. Always. It's very important. This is more for the senior athletes probably than the youth athletes. They may be with the youth athletes, we can talk about something different. But for them, it's sure you have to challenge them, because they are there for working for you to achieving result and not to praise you.
Right. So you have to make sure you're selecting, depending on what sport context or environment you're in, it's important for athletes to select or try and get the best sport medicine providers that they can, physiotherapists, and once they do, to then put their trust in those providers.
Exactly. At the end is going to be to trust them, because if you have the possibility to select them, so you know which is probably based on budget, based on experience of the staff, you have the ability to select the best that is going to be for you.
Right.
But at the same time, you have to challenge them, because you pay probably, or you directly or indirectly, you're gonna pay them to help achieve you, not to praise you. You don't need slaves. You need people they challenging you, and you have to challenge them.
Right. So it's good for athletes to ask questions, to try and
absolutely
make sure that the people that they're working with are knowledgeable or
and
competent.
if something is not going, it's different from what you think about it, you have to discuss with the physio, with the coach, with whatever. But at the end, you have to trust them.
Right. So
because you cannot evidence stuff, and then as soon as they say something that you don't like it or you don't understand, going for other stuff, or going for other physio, going for other doctor or other issue, because you want to hear what you want to do, what you want to know. So this for me is for the senior athletes probably is my advice.
Right. So it's important for the athletes to get questions that they have answered. Is that correct?
Correct. Absolutely. Absolutely.
And are there things that facilitate the athletes' communication then with their treatment providers? Things that help them in their communication with people such as yourself?
I was thinking, for me, based on trust, based on what we say before, they have all the doors open for them to have a clear and safe communication, because the other thing is to be safe, because sometimes athletes also share with you some important things for the social life or the family or other things. You have to be trusting that you put the right information to people that you're gonna not share immediately to other people.
right, right. So the
I,
athlete has to be able to share maybe private information with,
if they want, because
if they want,
if
right,
they want.
right. But doing so knowing that that treatment provider isn't necessarily going to, is going to use discretion about when or whether it's appropriate or not to share that information. And so,
Correct.
okay. Yeah, that's great information, and thank you for all your time, Marco. We spent
Welcome.
a lot of time together, so I really appreciate all your again, your insights, and I know athletes who will be listening to this will certainly benefit from getting your perspective. So wonderful to have you
Sure.
here today. Thank you.
Thank you.